Good morning, Flagler. The doctors are in. I'm Dr. Scott Cleos.
And I'm Dr. Andrea Cleos.
And we are here once again to talk about your health and health issues right here in Flagler, Volusia, and St. Johns County. I had my second of 6 general staff meetings the other day at Halifax, and I'm trying to instill in my colleagues a sense of responsibility and the fact that each one of us is an ambassador for that institution. And
we're an ambassador for all things in life.
Yeah,
we should never show our hiney. We should always show love.
You can show your hiney.
No.
I think that would be a good ambassadorial maneuver for you. I mean, again, for me, it would make me...
So tell me your story.
So anyway, I've been trying to tell them that it's imperative that, the way they act and the way they interact with patients reflects on the institution as a whole. And I'm sure you guys have all been there when there's one individual who can either make or break your day, right? I mean, if you're lost, confused, I tell them, I said, you see someone walking down the hallway and they're spinning around, looking up at the signs hanging from the ceiling. Take a moment, ask them where they need to go, walk them there. Takes you 3 minutes of your day. But the impact is priceless, right? I mean, if someone does that for you, if you're somewhere, and they're like, sir, can I help you find something? You feel good about that, right? It's like, hey, this person's really helping me out. Whereas if, a group of people walk by you sitting on their cell phones and they completely ignore you, like nobody cares about this place.
Cell phones need to be left at home, I think.
Yeah, well, I mean, they do use them. I mean, like our transporters use them. But, it's comes across as being, uncaring when you get your face buried in that thing and you're not interacting with your customers or your fellow employees. And it starts with your walk down the hallway, right? And I think I talked about this on one of the previous shows. It was disheartening for me to walk in that place in the morning wearing scrubs, doctor on my, scrubs.
Yeah,
and
we
my
did
name.
Talk about this, and your team dopamine.
Yeah, and people wouldn't, I'd say hi to them, and they wouldn't respond back. And I'm like, what is going on?
When did culture stop doing this?
Why is it? Or good morning. If you walk into Publix, you notice that when you're walking down the hallways, down the aisles, they'll look at you and they'll like, good morning. And, you're like, good morning. You respond back. And you should respond back, or if they say good morning to you. And it's the same in the hospital. But that whole interaction at the beginning of the day may set the pace for your entire attitude, right? So you see someone, you say hi to them, they don't respond back, you're already angry. You go upstairs and something else pisses you off, and next thing you know, you got a bad attitude. And, people pick up on these little cues about, their healthcare providers, and they're testing you. And I told my colleagues that. I'm like, guys, when you walk into that room for the first time, the patient is testing you to see how, if you're a qualified healthcare provider, physician. I don't like to use the word healthcare provider for doctors. We're MDs, DOs. Those guys are doctors. Everyone else who's not an MD or DO can be a healthcare provider. So, walking into a patient's room and saying, hey, what are you in the hospital for, is idiocy. Don't do that. You can't walk in and ask the patient what they're there for. You should know exactly what they're there for, because before you walk in the room, you've reviewed the chart. You've looked at their studies. You know what's going on with them. And when they have a question about, what was performed, you can respond intelligently and like you've actually done a little bit of homework. And it doesn't take long. I mean, with the electronic medical record, you look up really quick what's going on with the patient, and then you walk in there as an informed steward of healthcare. So, I kind of encourage them to do that. And we do send out surveys to the patients, exit surveys, and they respond on their care. And I've been doing walk-arounds with some of the administrators and asking the patients how they thought their experience was. And it's improving, and I'm proud of that because I think it's making an impact. And I know that I work with some awesome individuals, both physicians, nurses, technologists, ancillary personnel, people who are actually taking care of, food and cleanliness and all that. And there's good people out there. And to tell you the truth, most of those people are very responsive when I say hello to them. A lot of it's my own colleagues, and I'm going to try to, squash that. But everything that we do with the patient makes an impact, positive or negative. And so that's why we're trying to get together a group of individuals who are like-minded, pulling on the same side of that rope, because we have islands of excellence in a sea of negativity. And I'm trying to reverse that and make, little islands of negativity.
And we see that not just in your hospital, but in our world right now.
Right.
And this has started since COVID. And it's gotten worse. And it was probably starting before COVID. It just accelerated during COVID. People became isolated and entitled. And, you really don't have anything, because everything you've been given is a blessing. And the reality is sometimes we need to realize that sometimes we're born in more fortunate families. Sometimes we did have the courage and the strength to override a very difficult family situation. But where did that come from? Where did your internal integrity and strength come from? I mean, some of that is given to you by God. Some of it is a genetic thing that it still came from God. And so the reality is we should always be grateful and always strive to be better, no matter at what stage of life that we are. But we should always respect the people around us, no matter what. And it makes for a better day for you and a better day for them, just as you're saying.
Yeah. So, the whole experience is based on what we do for the patient and getting things out in a timely fashion. And we're losing, touch of that reality. And it seems like there's no urgency for anything anymore. It used to be patients would come in, they'd see the doctor, they'd order the test, they'd review them. The audacity of some of my colleagues is mind-boggling to me. I mean, just listen to this. So I'm sitting there at the chief of staff meeting. I'm sitting there as chief of staff in the med exec, which is right before the medical, general medical staff meeting. And the individual who's in charge of the ED starts lamenting about how to deal with the, unexpected urgent findings on radiographs. How do we relay that? And I'm like, okay, well, I said, this kind of sounds like it's between my department and your department. I don't think we need to burden the rest of the med exec with this. Let's you and I figure this out. And she was fine with that. And she's a really nice girl, and she's done a great job with, improving the patient experience then in the ED. So I give her tremendous credit. So I'm talking to her afterwards, and she goes, well, we need to, figure out a way to make sure that these unexpected findings are relayed. I said, well, first of all, the ED, the assumption in our department is the ED, these tests are being ordered emergently, which means that you guys are reviewing them real time, right? It's a different story if we're looking at an outpatient and they find an unexpected cancer, something that may kill the patient in the middle of the night, high-grade stenosis, in one of their vessels. Those we're going to call because there's some urgency to get that patient into a hospital setting so that they can be taken care of. But in the emergency room, the assumption is that because of the environment they're in, these tests are being reviewed immediately. So we don't normally call, emergent findings to the ED unless they're unexpected, right? So she was giving me this story of a guy that was diagnosed on an MRI with a tenosynovitis of his finger, which is an infection in kind of the tendons going to the finger. And they were working on transferring the patient back to the original surgeon, which was at one of our competing hospital systems. And so the results came back, went to the ED. The ordering doc left, never said anything about ordering the MRI. The next one came in and didn't know there was an MRI. And then the patient didn't get transferred for 2 days. And in the meantime, this infection was traveling up their finger, right? And so when they finally noticed it, they're like, oh, yeah, that was mentioned. So she goes, well, there's got to be some way to, for the radiologist to tell us about that. And they're like, the report turnaround was 10 minutes. After the report was done, it was read within 10 minutes, and the results were there. She goes, yeah, but the doctor that ordered it didn't read it and didn't pass that on. I'm like, that sounds like a you problem. That's not my problem. I mean, I don't know what you want me to. You want me to call up everybody?
But I do think sometimes needs to be multiple levels of security on something that's abnormal.
Okay, but everything can be abnormal. I mean, there's things that, but we don't have time to call every abnormal radiograph. And I'll tell you why we don't have time to call every abnormal. Because they're now abusing radiology. Because we don't have physicians who do an a priori physical examination on the patient and limit the body part that's abnormal.
Yeah, where it was 22 years ago.
When I first came here, in the middle of the night, the ER docs had to ask permission to do advanced imaging, a CT, MRI. It had to be something really urgent because you had to call a tech in for that. Now it's like a free-for-all. You got nurse practitioners, you got PAs, days. They're seeing patients. They don't know how to do a physical exam. So we're so
Or they don't do a
overwhelmed.
physical exam. They just
don't do
order a bunch of
physical exam.
tests and x-rays, because we did that in Gainesville when we had residents.
So now they're ordering a bunch of tests.
Supervised.
So we're so, drowning in studies. So this is what the government solution was, is to, have more people improve what they say is throughput, get more people seen by non-physicians, and so they're abusing laboratory and radiology studies and services.
It's not great for the patient.
No, it's horrible for the patient. So now there's such an overwhelming, and somewhere buried in these umpteen thousand, needless radiographs and labs, there's probably something important. But it's hard to separate those out because the volume is overwhelming, right? Because of the way our practice is set up, we have a turnaround time of less than 10 minutes. I mean, which is unheard of most of the places. And I'm going to give you an example in a second. But our competition up the street, supposedly, they have studies that aren't read for 10 days. I mean, and some of them come back as an emergent read after 10 days. Hopefully the patient's still alive. That's how bad it's gotten. But the government is paying less and less for radiographic studies and expecting us to do more and more because they've got incompetence on the front end because of the policies they've established. But all we're doing is following in the footsteps of our, colleagues across the ocean who have been in a
national healthcare
and been in a national healthcare system, which is just falling apart.
As you can see, which we've happened to us since we've had Obamacare, it has deteriorated. Our healthcare has deteriorated drastically in the last 12 years.
Horribly.
Horrifically.
And so this came out, this is something from a release put out this week by the Royal College of Radiologists, the overseeing body of radiology in the UK. And they've got a full-on national healthcare system. Describes the reporting delays as the worst on record. The RCR, Royal College of Radiologists, noted that a record 976,000 scans sat in a queue, waiting to be read for more than 1 month in 2024.
Jeez.
1 month. Okay, so these could be things on there the patient's going to die of and maybe did die of. This figure represents a 28% increase from 2023 and a stark failure against the National Health Service target of 0 scan results taking longer than a month. A month! I mean, they say they don't want any being a month. 2 weeks is okay. We have a 10-minute turnaround time, but it's not sustainable because they keep paying us less and less for these studies. You can only spend so much time on them.
And you have more and more incompetence. The system needs to become more competent, not less competent. And this is what's happening. And if you guys don't stand up for the insurance, this was my argument many, many years ago when I had a battle with the president of the FMA when I was president of our county medical society with the Florida Medical Association. And I said, this is a patient violation. The fact that we are supporting alternative health care providers who are not trained properly, and I'm not saying they can't be, but they're currently not. They're ordering excess tests. They're in positions they shouldn't be in alone and not being supervised. What happens is the patient gets exposed to more radiation, more tests that can lead to more unnecessary workups that cost more money. And in the end, they're paying the same price as they would have paid for a physician. The insurance company is still billing the same amount despite the fact that you're not seeing a higher quality of care. And healthcare as a nation has deteriorated since Obamacare. And so unless you, as a consumer, don't stand up to your health insurance plans and your health insurance agencies and say, I demand to have physicians, I'm tired of incompetent care, and explain why this is a problem. Now, there are some very nice people that are physician assistants. And sometimes as a patient, you don't even realize that you're not getting quality care because of the fact they're very nice. But nice doesn't cut the mustard when you need a diagnosis and when you fail to get a proper workup and timing and delivery of care and the most efficient form of care. This is the problem. And this is what we're facing in ER systems. Maybe ER systems should be with physicians and not with ancillary healthcare providers, maybe a combination. But what's happening now is a failure of the healthcare system, and it's grossly across the board because I don't know anyone who is happy in their current healthcare state.
No, and the problem is they're paying these primary care docs less and less.
As well as radiology in your reads, as you state.
Yeah, I mean, but they're paying all of us less, and the insurance companies are killing it. They make billions of dollars, so what they do is they charge the patients a lot of money, and they don't pay the doctors or the hospitals, and they're keeping all the monies for themselves. So it's 100% part and parcel of the insurance companies, and of course
they're not regulated.
And of course the lawyers. Well, they are regulated, but they know ways to get around that. They've got great lobbyists, and the lawyers, these guys still charge you by 15 minutes. If I could charge for every 15 minutes of the advice I give, geez, I'd be killing it. These lawyers charge 15 minutes. The last lawyer I dealt with, we called him Lawyer Bob. He was in charge of my dad's estate. The guy was a moron, and every time. The best story I heard from Lawyer Bob was that, he calls up Jeff and asks him a dental question.
That's
my brother
brother.
is his dentist, right? And he asks him a question about his own health care. And so as he's asking him, he goes, "Oh, so how's your dad doing?" And he goes, "Well, we're trying to do this, this, and this, and we're trying to settle this." He goes, "Okay, well, we can, if you ever need me to talk about the estate, I'm here." And he goes, "Yeah, I got it." And then he sends Jeff a bill for that conversation, 15 minutes of consultation. For like $100, and he charges like $400 an hour. So he charged him $100 for that. And he calls up Bob. He goes, "Bob, are you for real?" He goes, "You called me to ask about your dental health, and we've mentioned my father, and you send me a bill. What the hell?" That's how ridiculous these lawyers are. Some of them. I have lawyer friends who are awesome, but, the unscrupulous ones, they think that their word is, something directly from God. And they can charge $100 for every 15 minutes. It's repulsive. But, we're basically pricing primary care docs out of the market. They can't pay off their school loans,
Well, and they can't go into private practice. You have to work for a conglomerate agency, and that's a shame. Because then they're given 15 minutes to take care of their patients, or 20 minutes. They don't have time to do a proper evaluation. They don't have time to take the time to listen to a patient and care for them properly. This is a serious issue.
Yeah, we're starting to provide, cash, a cash list of what exams cost, because it's so hard on patients to get studies done. They have to go through the rigmarole of the insurance company telling them they got excruciating back pain radiating down their left leg, and they're like, "Oh, you need a radiograph for your back." That's not going to give you the answer. 100% of the time it's not. And then they have to go to rehab, and then they can get an MRI. So they make them do all this other crap, hoping that they're either going to give up or die. I don't know what it is in the process. Whereas talk to the doctor, like, "Yeah, with this symptoms, I need an MRI so we can figure out what's pressing on the L4 nerve root and we can fix it." But, what has happened in healthcare is exactly what Ed Annis warned everyone back in the 1963, when he was then president of the AMA, said, if we allow the government to get involved with healthcare, they're going to basically destroy the sacrosanct patient-doctor relationship, and they're not going to allow the doctor to make patients appropriate for their patient. And so that's where we're at. Unfortunately, it took 60 years to get there, and everyone who the naysayers back then are all dead and gone, so you can't blame anyone anymore. I don't think we've taken a break yet from this show.
We haven't. Nope, it's time.
Getting late, so let's do that right now. So if you have any questions for myself or Dr. Andrea, you can email us at thedoctorisin@WNZF.com. You're listening to The Doctor Is In on WNZF News Radio, 1550 AM, 94.9 FM. Stay tuned. We'll be back in a moment.
Radiology Associates has been a trusted name in Volusia, Flagler, and St. Johns County for over 50 years. Radiology Associates is the first and only radiology provider to bring our neighbors of Flagler County 3 Tesla MRI, 64-slice CT, and time-of-flight PET CT in our Palm Coast Imaging and Town Center Imaging locations. This is our community. Our doctors live here and strive to provide only the best care to you, our neighbors. For more information about Radiology Associates, visit us online at radiologyassociatesimaging.com.
Thank you so much for recommending us to your family and friends. When you need a 30, 60, or 90-minute massage, it's real easy to book your appointment online. MassageByNatalie.org. MassageByNatalie.org.
And And we're back. For those of you just joining us, Andrew and I have been on our soapbox today, each one of us on our own soapbox, talking about the deterioration of healthcare in the United States. I gave an example from my own profession, the Royal College of Radiologists in London, or I guess in the UK. They were lamenting how they had almost 950,000 studies that were not read after a month.
And we want our healthcare system to be like Europe?
Yeah.
Free healthcare? Come on, guys. Are you kidding me?
We at Radiology Associates, we're taking up all of these other practices all over the country because, we've got a system that provides, minute turnaround. I mean, these people can't get a radiographic study read in a month. We do it with 10 to 15 minutes. And I feel vindicated because over the years I used to go to the gym and people would say, "Man, I got a shoulder MRI at your place 2 weeks ago. You guys still haven't read it." And I'm like, "No, we read it. It's just your doctor hasn't gotten back to you yet." "No, they said you guys haven't read it." So now we have a patient portal. So the patient can log on as soon as I see it and they see that we read it. So now they come in, "Man, you guys, you did that MRI. You guys read it immediately. I still haven't heard from my doctor." I'm like, "That's the way it's always been. It's always been that way. Nothing has changed because we've always had turnaround times like that. Everything's read by the end of the day or at the latest the next morning." So, at least we've been vindicated with the technology, but it doesn't make any excuses for the, crappy quality of healthcare because, nothing seems to be urgent.
Systems problems.
But it's the same everywhere. I was just dealing with an air conditioning company that did the same thing to us. They come out, they send some buffoon who's, I don't think he's ever been educated in the technology of, HVAC architecture, and he screws up one of my systems, basically is a big jerk. I got a place, someone renting our place up in St. Augustine, turns all the air conditioners off and leaves the house.
Oh, my gosh.
That's how he walks out. So, of course,
hopefully they fire him.
So this is the story. So, I try to call them back. They ghost us. I don't hear from anyone. So I never do this. I don't go on and write. But I was so upset because I've got a renter up there and they don't have air conditioning, and it's been in the high 90s, and I feel bad for them. So I wrote this scathing review about the company and talking about how, disappointed I was. So of course that afternoon I get a call from their, from the service manager, who was very nice on the phone, and basically, apologized. The person they were sending out, they did fire, okay, because they knew he was incompetent or something. And he also said, "I know this is an excuse, but we've lost a lot of office staff." And I said, "Look, I understand. I mean, we're going through the same thing. We can't keep people around working for some reason. They don't want to, stay and work in a job anymore. So I don't want to denigrate your business, but at the same time, I don't want to be ignored. And if somebody can call me up and let me know what's happening and what the plan is, I'll be okay with that." And I promised to him that I would either, retract or amend my scathing review once I had some, resolution to the problem that we're going through. And he was very appreciative of that. But, as a business owner myself, I want to know what the problems are, but I expect my staff to respond to reasonable complaints. I mean, if they're unreasonable, of course, we can't do anything about that. But, reasonable complaints, they need to be addressed. And as I've said in the past, I'll get a message from my nurse or my tech about how, difficult a patient or their family member is, and rarely when I go in there, as I told you guys on previous episodes, prepared, where I review their chart, I see what's going on, and I walk into the room ready to answer their questions, how their whole demeanor changes. For the most part, I've had a couple of people, they just want to be jerks no matter what you do for them, and I just discharge them. They can go to any hospital they want. It's not a big deal. But, almost all of them, no matter how bad my staff talks about them and how, horrible of a human being they think they are, once you start showing them a little bit of kindness, it's amazing how nice they actually are. They're just tired of being jerked around by the system.
Yeah, and I think we all just need to remember to do that. And we all need to stand up for what's right. When things are wrong in life, you need to stand up for right. And that means sometimes we got to make some phone calls. We need to call people out. We need to hold them up online. If it means that you have to, denigrate their company online to say, "Hey, listen, this is what happened," or at least get a hold of them and say, "Hey, what's going on?" And, this is what is important so that we try to pull back what we used to have in America, which is quality of care, quality of people, quality of services in healthcare, which is probably the most important service we have. Because when we have our health, we have everything. If you don't have your health, no matter how much money you made in your life, no matter how many things you got going on, if you don't have your health, you can't do all those wonderful things.
I think the most important part of all that is corralling the positive individuals and making that the culture of whatever institution you're working in. Because
True.
The problem is with all this negativity, you become complacent. You're like,
blame everybody instead of doing something.
I want to make it better, but I can't do this. I keep trying and trying and trying, and you feel like the proverbial Don Quixote. You're charging the windmill, nothing's changing, and then finally you just fall in line. Well, nobody else cares. I don't care either. And that's reflected in the quality of the healthcare that you're providing or whatever service you're providing. So, what you need to do
go to the top.
No, I don't even know if that works.
Sometimes.
Andrea. I mean, I don't even know if that, because, they're all in cahoots, and you get into a position like, and I know you hate when I talk about the VA, but it's a bureaucracy. And in years past, the bureaucracy, the main purpose of the bureaucracy is to maintain the bureaucracy. Quality was secondary. All right. And, they would actually have individuals who loved working at the VA because they didn't have to do much, and I've encountered these individuals. But, if you got the right group of people, and usually it's easier in a smaller institution. The smaller the institution, the more cohesive the staff are, and they're supportive of each other, and that provides a positive environment that is both great to work in and to heal in. And that's what I'm trying to do with a bigger entity like Halifax, and we'll see how successful I am, but I do think we're making strides in the right direction. So, well, any words of wisdom to close this show off with?
Fight for the truth.
There
Always
you
do
go.
the right thing. Have faith. And march on.
Okay, and Andrew and I are still celebrating our 30th wedding anniversary. So I'll be chasing her around after I, kind of grease her up.
We'll share with you about our trip once we're back.
Yeah, so our extra virgin olive oil.
We're going to be meeting my guest parents in Germany who actually have their 60th wedding anniversary. And we'll also be meeting the scientist who invented the beamer and the cloud, our pulsed electromagnetic frequency devices.
By the time you guys are listening to this, we will be back. So
yes,
we will tell you all about it.
Well, we'll be back the following week. So we can't wait to talk to you about that.
All right, guys. If you have any questions for myself or Dr. Andrea, email us at thedoctorisin, DOCTORISIN at WNZF.com. You're listening to The Doctor Is In on WNZF News Radio, 1550 AM, 94.9 FM. We'll see you guys next time. Stay happy and stay healthy.